I woke up and I looked around. I couldn't. And that was it. It was like that, for months.
Communication in hospital is really vitally important because it's people's lives, it's their medications, it's their therapy, it's their family life, it's everything.
There are some strategies that we can use to maximise our communication with our patients.
If I know that someone's going to have communication difficulties, I often go in there and introduce myself and get their attention.
Hi Christine, do you remember me? I'm Dr. Venugopal. Would you mind if I switch off the telly? It's alright. Would you mind if I close the book? I'm here to talk about the blood test, which we did the other day.
The doctors were very good, very kind, but I felt that perhaps if they slowed down a little bit with what they were telling me, I would understand more.
When someone says something to me, the first time I never could catch it, and so I always have to get them a second time to say that question again.
Maureen, today I'd like you to make a cup of coffee. There are a few steps in this process. I would like you to boil the kettle, collect a mug, prepare the coffee and pour the water into the mug.
The common mistakes are rushing, introducing too many topics at once and not allowing people time to reply.
If the patient is silent, that does not mean they're okay with it. It's good for you to wait and give the time for the patient to ask the question because they may be concerned about the medical situation.
People used to say to me, "Come on, hurry up," when I was just trying to say something to people. But see, I'd sort of there, and I'm just trying to think of what's the best way to say it.
I might use a process of elimination. I'll sort of ask yes/no questions about what I'm trying to find out.
My body language and my facial both make tremendous difference.
Hello Graham, how are you?
Not bad.
Not bad? Oh, you've just had some lunch?
Oh, no.
No?
That's
Have you eaten yet? Not?
Out there.
Oh, out there. Oh, you didn't have lunch here today. Did you have lunch in the cafe? Oh, that would have been nicer.
So some patients will have a communication book. These can be either written words that they recognise or perhaps pictures as well. Okay, Simon, today in physio, we're here to set some goals. Okay, mainly about your walking. Because it's hard for you to communicate, I've brought along some walking aids today and some pictures here to work out what you'd like to aim for. Alright.
Sometimes it'd be a little like, "Was it that?" I said, "No." And "Was it that?" "No." "Was it that?" "Yes."
So if a patient is really trying to get across a message and I'm not understanding it, I think I would perhaps go to family or to another person who's working with the patient to problem solve together about what this person is trying to get across.
Yeah, that one there.
Hello.
Oh, g'day Jackie, how are
Hi.
you?
Good, thanks. I'm glad I caught you. I was having a chat to Graham this morning and I just want to confirm with you, does he have an egg allergy?
Yes, he does.
Okay, thanks. The advice I'd like to give to others is to be sensitive and respect people as individuals, as they are.
So people just see me what I am, not what happened to me, nothing like that.
I'm still going inside.